I got an email about 3 days ago. Today's March 23rd, and the email was actually before the Obama health care bill reform was actually passed. And the email said, "We all must do something. This wonderful Dr. Roger Starner Jones is an ER doctor from Mississippi, and he has interest in golf and hunting and fishing, and he specializes in emergency medicine. And during his shift, his ER rotation, he had the pleasure of evaluating a patient with shiny gold teeth and multiple tattoos all over her body, expensive pair of tennis shoes, and a cellular phone that had a R&B ringtone. You know, who cares about what the ringtone is, doctor? I don't care if it's country. I don't care if it's classical. And whether she chooses to wear gold teeth or porcelain veneers, that's really not the function of your job." And he goes on talking about how she smokes a costly pack of cigarettes every day and how somehow she has enough money to buy beer. And dear Mr. President, why should I pay for this woman's health care when she's on Medicaid? Hi, my name is Joe Weaver, and I'm a registered nurse in New York City. And this is really to oppose the emails and the internet blogs from Dr. Roger Starner Jones, who posted he's an ER physician who noticed during his rotation that he saw this woman who had gold teeth, expensive tattoo, who smoked. I guess he assumed that she drinks also. Beautiful tennis sneakers, and said, when you look through her chart, oh my God, she's on Medicaid. Why should I pay for her health care? Dear Mr. President, Obama, I don't agree with this. Well, like I said, I'm a registered nurse, and I don't make a lot of money, but I don't make a little bit of money neither, and I have to pay 1% out of my, what do I make, 100K plus salary. It's not going to bother me, because that's my God-given right to be an American, the best country in the world, to be able to give back to our fellow Americans. Perfect example, when I went from a med-surg floor to the OR, didn't work out. I left looking for a new job. Took me maybe 3 months. My health insurance expired within the 30 days. Cost me a figure to have my daughter and myself covered when I wasn't working, looking for another job. A good job. I think they wanted something like $1,400. Some people don't even make that in a month. That's some people's rent, especially in New York. It's someone's, I mean, how could you think that we should not have health care? Dr. Jones, have you ever traveled outside of Mississippi? Have you ever went to Europe? I've lived in Germany and I've studied in Germany, and I know the healthcare system really works. Everyone has health insurance. If you're rich, you can opt to have private health insurance, but I just can't believe that any healthcare professional would make a statement. If I'm able to help others, I do it. And being unemployed, I know what it feels like to try to support my family, looking for a job, and pay for my daughter's health insurance. I wasn't able to do it on my salary. I was able to pay for my daughter's health insurance. It was like $800 a month. But I said, you know, I'm a healthy guy. I just opted not to include myself. But that puts my family in jeopardy. What if I got hit by a car? I wouldn't have had health insurance because it lapsed after I left the job. This will eliminate that. This Obama health care reform will eliminate the the hold that these insurance company has to just charge us whatever. And this COBRA system does not work. Having health insurance is something that America should have had for every single American. It's a God-given right. I don't even know how Germany is able to have free health care. And also, the discrimination of health insurance companies will be eliminated. No more pre-existing condition clauses in health insurance contracts. So if you have a pre-existing condition, a medical condition, they really can't say, well, we're not going to pay for that, or we're only going to pay for maybe 3 months and you just exhausted all of your insurance money, so we're not going to pay after December 2. Tax credit will be given for those Americans who still cannot afford to avail health insurance to help them have one. Stiff competition among health insurance firms will possibly result in a much lower insurance cost and more quality and services. Aside from eliminating pre-existing conditions, the coverage amount of some insured will also be waived by health insurance companies. Now there's downfalls. Yeah, there will be a tax increase on people who make a very high income. I'm not one of those people, even though I'm a medical professional. But if you're making more than $500,000 per year, there will be a 1% tax increase. So if you're making $500K, you have to pay 1. We all need to finally stop judging people and judge yourself. Judge your own ethics. Judge your own responsibility. Don't worry about what other people are doing or how they're getting over. But you as a human, we need to help other people who are less fortunate, or those who are lazy and haven't had the strength, or they don't even have the drive to go further. But as I see it, working in the emergency room many times, in psych and just people coming in there, and because they don't have a primary physician, so they use the ERs to get treatment. They give phony addresses. They give Dr. Roger Starner Jones. He may not ever be unemployed. I'm an RN. I may decide to change my profession and go into another field, and in that interim, I'm going to have to pay for my health insurance. It's going to be exorbitant. I'm tired of it. I'd rather invest in that money. So we all have to think that Obamacare is not evil. It's not the best. I would like to see it more like the German healthcare system, but it's a step. It's a step in the right direction. And there may be lots of things that we may have to do. Obama isn't the first person who attempted this. It's something that is well deserved, and I'm glad that the health care bill was passed. And hopefully, we know that the Republicans will try to stop it, and they may be successful or they may not be successful. I just hope that they're not, because as a healthcare professional, I can't decide who I want to treat. I can't decide if you're an abuser or if you are a child pervert. I can't decide as a healthcare professional. I'm not working with you. I'm not going to touch you. I'm not going to give you your medicine. I'm not going to give you an IV. You take an oath. And I take an oath as a human being and a person who believes in God not to judge people because they wear gold and they have Medicare. That's not my place. But if I am more fortunate than those, I will give what I can. And that's what I'm asking all Americans to do. If you've ever traveled outside of the United States to places like India and places like China and places like Africa and Haiti, you know how fortunate we are. And that's all I can say. I am 100% for healthcare reform. And this is Joseph Weaver, RN, New York City. Take care.